Well, it's a disease that's responsible for an estimated 2 million broken bones per year. Chances are you or someone you know has dealt with osteoporosis. Dr. Kohli is here to help us prevent broken bones and disease from happening. Well, we have the wonderful Dr. Kohli back today.
Thank you, Jenny.
Yes,
How are you doing?
doing well. How are you?
I'm great, thank you.
Good. Okay, well, today I want to talk to you about osteoporosis. First of all, can you tell us what it is and what causes it?
Osteoporosis is a condition that really scares me because it's often silent and it's a thinning of our bones.
Okay.
And most of us are going to have osteoporosis as we get older because it's a natural part of the aging. And essentially how bone kind of turns over is that it breaks down and it builds. It breaks down and it builds. And usually that's at a steady state. As we get older, our hormone levels change both in men and women, more common in women, but also in men. You actually have not as much building of the bones. You're still breaking it down, but you're not building it. And sometimes you're on medications that can actually accelerate the breakdown, especially if you have prostate cancer and you're getting, medicines to block your hormones or conditions like that.
Yeah.
So it's a thinning of the bones that can lead to problem because if you think about our bones, they're holding us up.
Yeah.
Right?
Right.
All the muscles, all the movements, all the things that we do, they're really sort of the foundation of our bodies. And so having disease in the bones can be really challenging as we age.
Oh my gosh, yeah, and that's so scary, especially whether it's for us or for our loved ones. We want to make sure that we're, taking care of that skeletal muscle and that, everything that's inside. Okay, so how do we know if we do have osteoporosis?
And that's the thing, it's often a silent condition. So unless we go looking for it, and like I said, postmenopausal women are sort of have the target sign on them, but maybe even men as they get older. Unless we go looking for it, sometimes we don't know. So some of us, it'll present itself in a terrible way with a fracture. Okay. And I'm talking about fractures with sort of minimal trauma, so wrist fractures, hip fractures, those types of fractures that shouldn't have broken a bone, but they actually broke the bone. And that's almost at the point where the horse is kind of out of the barn.
Sure.
Sometimes we lose height, and that's our first sign that we actually have osteoporosis because the little bones in our back are starting to compress and squish down. They're losing their structural integrity and they're squishing our spine, so we're actually losing height. And you often see many of the old grandmas kind of hunched over.
Yeah.
That's called kyphosis, and that's little fractures in their back that's causing compression of the bones that are supposed to be the discs that are kind of holding up our spine. Okay. So those are sort of the most common ways that we know, but really the way we should know, most of us after menopause and men as we get older should go and get a DEXA scan. That's a bone density scan. It's part of our regular care after menopause. We should check it so we know exactly what our bone density is.
Okay, good to know and good to be preventative about it. Now, how do we treat this, and is there anything we can do to prevent it?
There is. And so calcium and vitamin D is really important because when we're vitamin D deficient, and that includes young women as well, young men, we melt our bones to liberalize the vitamin D because our body needs the vitamin D. So we actually release this hormone called parathyroid hormone that kind of liquefies our bones, puts that vitamin D out there. So it makes our bones thinner. So it's really important for us to make sure that we're getting enough vitamin D, checking our vitamin D levels, keeping them around 40 or so, so that we're replete. Sometimes we'll recommend calcium supplements. Now we have to be careful with calcium supplements because too many calcium pills can cause calcium deposition in the arteries around the heart and such. So it's really a balance when it comes to osteoporosis, but making sure you're getting enough calcium-rich foods that supplement your diet so that you're really maintaining a good intake of calcium. And then there are medications that we can use to treat osteoporosis as well and reverse the process. But again, for many of us, the process starts a lot earlier than menopause or soon after menopause. And unless we really check, we have a family history or, we've had cancer that makes us hormone deficient or something, many of us don't think about checking, but really every single woman after menopause should be having that DEXA scan so she can get checked, she can get treated, and you can prevent that fracture because once you have a pathologic fracture, bone is one of the slowest healing structures in our body. That's why you have to wear a cast for like 6 months or whatever. Yeah, because it takes forever for bone to heal and it can really change your life expectancy if you have a bad fracture at an older age.
Definitely. If we are looking for foods that are more dense in calcium or vitamin D, we're saying, right? Yes. What should we look for?
So of course, any kind of milk-based products, yogurt and milk, those are helpful. Sometimes even some of the plant-based milks, like the soy milks and the almond milks, can be fortified with vitamin D. So it's really important whenever you're buying any of those type of products, just flip it over, take a look at the back of the calcium content and the vitamin D content. Because we don't think a lot, especially for someone who doesn't eat a lot of dairy products, if we're vegan or something, about how we're getting our calcium and vitamin D.
Right.
And we know that sunlight activates vitamin D, right? But here in Colorado, we wear a lot more sunscreen because we have risk of that, and that can prevent some of that activation.
Sure.
So we can, and we spend our time indoors, we can actually be deficient. So looking at some of those milk-based products or the plant-based milks, vitamin D and calcium content can be really helpful. And then a blood test, a simple blood test that you can self-order on many different websites. You can check your vitamin D level and know exactly where it is, and 40 is kind of that sweet spot.
Okay, all right. Well, prevention is obviously key here, huge when it comes to making sure that we're safe and our families are safe too. Dr. Kohli, thank you so much.
My pleasure, Danny.
Make sure to email us your questions for Dr. Kohli. Just send us your message to mycoco@9news.com and put Kohli in the subject line.